Hi, good morning, doctor. My name is Antonio of Philcare Pharma, a Filipino-owned company that specialized in anesthesia, anti-infectives, and critical care. And I'm here to introduce to you the first line of defense for management of hypertensive emergency in congestive heart failure and acute coronary syndrome, our intravenous nitroglycerin nitrosan, 10 milligrams per 10 ml. It is clear and isotonic. It is a clear, colorless, and isotonic sterile solution for intravenous infusion. It is available in 10 ml ampules containing 10 milligrams of nitroglycerin or glyceryl trinitrate. Hypertensive emergencies are common cases managed by medical practitioners in the hospital, distinctly those in critical care areas. It encompasses a spectrum of clinical presentations in which uncontrolled high blood pressures lead to progressive or impending end organ dysfunction or damage. According to Christy Hopkins, Medical Director, Division of Emergency Medicine, University Healthcare, and a member of the American College of Emergency Physicians, the most common clinical manifestations of hypertensive emergencies include cerebral infarction, which has about 24.5%, pulmonary edema with 22.5%, hypertensive encephalopathy with 16.3%, and congestive heart failure with 12%. And the other associated clinical manifestations, associated with hypertensive emergencies include intracranial hemorrhage, aortic dissection, eclampsia, as well as myocardial infarction, and renal and retinal involvement. Therefore, with these conditions, the blood pressure should be lowered aggressively over minutes to hours. So, nitrosan is the solution you need. IV nitroglycerin nitrosan reduces the load of the vascular smooth muscles with a more marked effect on the venous capacitance vessels. It reduces venous return to the heart and lowers elevated filling pressure. Thus, lowering of filling pressure reduces the left ventricular and diastolic volume and preload, thereby reducing myocardial oxygen consumption. IV nitroglycerin nitrosan also reduces systemic vascular resistance. It reduces pulmonary vascular and arterial pressure, thus a reduction on afterload. To be specific, its mechanism of action involves the synthesis or combination of nitric oxide and cyclic guanylyl monophosphate, which is a mediator of muscle relaxation. IV nitroglycerin nitrosan is converted into nitric oxide in smooth muscles. It activates guanylyl cyclase, thereby increasing concentration of cyclic GMP, resulting into smooth muscle relaxation. Also, nitroglycerin nitrosan causes coronary artery dilatation, thereby improving myocardial blood circulation. So, therefore, IV nitroglycerin nitrosan has a marked improvement in reducing preload and afterload. There's a marked improvement in reducing preload and afterload. There's a marked effect in reducing preload and afterload.
Hemodynamics reduction.
In hemodynamic reduction of systolic wall and an increase in the depressed cardiac output. It also reduces the imbalance that exists between myocardial oxygen delivery and demand, thereby diminishing myocardial ischemia and controlling ischemia-induced ventricular arrhythmias. Another good attribute of nitroglycerin nitrosan is that it is an ideal partner for hypertensive emergencies in pulmonary edema, congestive heart failure, and myocardial infarction. Because it has the properties of an ideal IV antihypertensive like rapid onset of action, that is only 1 to 3 minutes. It also has predictable dose response that when you give it at higher, especially at higher doses, you would expect immediate response or effect of the medication. It is highly vascular selective, that when given at lower dose, it causes venous dilation. And at higher doses, above 150 micrograms per minute, it causes arterial dilation. It is easily titratable, so to your desired blood pressure level. So less worries for hypotension or hypoperfusion, since it is easily reversible. It has short half-life of 1 to 3 minutes and a duration of action of 3 to 5 minutes. It maintains cardiac output and stroke volume, and it does not display coronary steal. It also has less incidence of adverse events like hypotension, making it safe for your patients. And also, it is more cost-effective as compared to IV nicardipine and isosorbide dinitrate, with its catalog price of only 490 pesos per ampule. On scale of effectiveness, IV nitroglycerin nitrosan is incomparable compared to IV nicardipine because of its strong reduction in preload and afterload. It is proven to be more safe and effective in treating severely hypertensive patients with congestive heart failure and left ventricular dysfunction, because it has more profound effect on the systemic vascular resistance without increasing the adverse events. On another note, IV nitroglycerin nitrosan can also be used to treat patients with preeclampsia. Preeclampsia is a pregnancy complication characterized by high blood pressure and signs of damage to other organ systems, usually the liver and kidneys. It occurs more commonly on women who are chronic hypertensive, but more importantly, it can also occur on women who are previously normotensive. And in these patients, acute BP elevations of up to 150 over 100 millimeters mercury can produce significant symptomatology which requires treatment. And when left untreated, these cases or complications can lead to serious and even fatal complications for both the mother and the baby. In a study by R. Ali et al., preeclampsia is usually treated by medications such as calcium channel blockers like nicardipine, beta blockers like labetalol, and hydralazine. Hydralazine is a direct peripheral arteriolar vasodilator. It is widely used in treatment of acute hypertensive pregnancy-induced hypertension. It has a slow onset of action, about 10 to 20 minutes, which peaks about 20 minutes after administration. In a study by R. Ali et al., this is about the safety and effectiveness of hydralazine versus intravenous nitroglycerin in treating patients with preeclampsia, wherein a total of 180 patients were enrolled and divided into two groups, which are either to receive 1 milligram per ml of hydralazine and 1 milligram per ml of nitroglycerin, both with an infusion rate of 5 ml per hour. The results of the study showed that the time that is needed to bring down the blood pressure to the desired level is shorter in the nitroglycerin group as compared to the hydralazine. Also, nitroglycerin shows less incidence of tachycardia and other adverse events. For posology and administration, the usual dose is For posology and administration, IV nitroglycerin nitrosan can be given as a bolus, and using the tenfold dilution of the concentrated vial, it can be given as a push. For a concentration of 100 microgram, you will need 1 milligram or 1 ml of the concentrated vial diluted or mixed with 9 ml of saline solution for a total of 10 ml volume. Sorry. Sorry, ma'am.
Surgery. For surgery use.
Sorry, ma'am. Okay. In a study by Levy et al. is about the treatment of I missed na Chadruwi trial. A study of Levy et al. Is about the treatment of severely decompensated heart failure. It is